Hi everyone. So today I am doing my project on HIV infection in older adults, and my name is Shelby, and I am just about done this program. Woohoo! So first, before really getting into the topic, there was just a couple of things that I thought were pretty important to just kind of let the audience be aware of and let the audience know. The first is that older adults, whenever I'm referring to the term older adult, I'm going to be talking about anybody ages 50 and over, unless otherwise specified. Some of the statistics that I have may say 55 plus or things like that, but for the purpose of this assignment, the article primarily focuses on 50 plus, so that's what I'm using as older adults. Also, just so everybody is aware, the full term for HIV is human immunodeficiency virus. And also, it's very important to remember that this disease knows no bounds. So it does not matter your culture, your skin color, your gender, anyone is susceptible to getting HIV. And that's just something that I thought was important to state at the very beginning. So HIV in older adults, why is this an important topic? I have done my undergraduate degree in gerontology, so I feel very strongly about discussing the needs and the wants of older adults, and I feel that a lot of times sexually transmitted infections and diseases are often overlooked, but they are a very vulnerable population as is, and especially so when it comes to HIV as well as other STIs and STDs. So here's some just basic statistics to consider. According to the Centers for Disease Control, there are approximately 1.2 million Americans diagnosed with HIV. That's not just a statistic related to those older adults. However, I thought that that was an alarming amount of people, and when I saw that, it really shocked me. Additionally, in 2012, people who were 55 and older accounted for almost a quarter of all Americans living with HIV. And that to me was also very alarming. Now, it doesn't necessarily mean that those people were diagnosed at 55 and older, but it means that those people have either been living with this disease and are now reaching that cohort in their life, or it means that they were diagnosed relatively recently once becoming in the 55 and older age range. And also in 2013, 18% of those diagnosed with HIV were 50 and over. While that doesn't seem like that many people, it's still a pretty big blip on the radar. Here is a graph that I found that was on the CDC's website. Again, this relates to the statistic that I just said about the estimated diagnosis of HIV infection. And so as you can see, those who are 20 to 24 had the highest rates of HIV diagnosis, but the 50 to 54 age range right over here still has a huge amount of people. And as you can see, the rates do decline as people get older, but that could be because people either aren't being screened and maybe are just running around having sex and not being diagnosed, which is also very unfortunate. So it's a bit of a cycle, and it's difficult for researchers to determine how exactly how many people there really are that are infected within that 50 plus range, because a lot of people aren't having the necessary screenings that they should be, and it's causing a lot of gaps. So there could, while right now there's only 24% of those infected, there may be thousands more, which could potentially totally change that percentile. But as of right now, those are the actual numbers. So. And if you're still not sold, I have a great video that's actually a local video that I thought was very interesting. So I'm going to go ahead and play that for you. So here is the video, and again, I said it's local to the Baltimore area, but I felt that it was really interesting to see and hear from the local media how Baltimore is choosing to handle and is aware of the issue of older adults with HIV in our area.
It's been a long time since Jessica Hurd has sat in a sex education class.
Yeah, I thought I knew it all.
But it's what seniors like Jessica don't know or may not be aware of that has city health officials concerned. A growing number of older adults are being diagnosed with HIV and STDs, and it's the reason behind a free seminar at the Waxter Senior Center in Baltimore.
When we looked at the numbers for people living with HIV in the city in 2010, about 45% were over the age of 50. So we know that this is an issue for older adults, and I don't think enough attention has been given to them, either in terms of making them aware that they should be tested, they should watch their sexual habits, and they should be aware of HIV/AIDS in their community.
Awareness is just the first step. Assistant Commissioner for HIV and STD Services, Dr. Patrick Chalk, says testing is key, and last year the City Health Department performed over 46,000 free HIV tests.
And in terms of testing, people should realize that now there's a home test available through most pharmacies, so you can, in the security of your home and privacy of your home, be able to test yourself.
Because safety in the bedroom is something Jessica used to take for granted. Not anymore.
It used to be, but not now. So many of my friends had that false sense of security, heterosexual, and things are just coming up that shouldn't be, and I don't really want to fall into that trap, so I'm trying to educate myself so that I can take every possible precaution so I won't.
And over the next year, health officials will address other concerns involving seniors, including hoarding, mental health, financial concerns, and elder abuse. And if you'd like more information, contact the Baltimore City Health Department. In Baltimore, Jennifer Franciotti, WBAL TV 11 News.
So, like I said, that is a local media outlet, WBAL TV, and I felt that as soon as I saw that video, I was floored to see that the Baltimore area is trying to do something and is trying to make our older population aware of a rising issue, and that prevention and awareness is key, because this really ties into what the article that I chose to review discussed. So the article that I read was called HIV in Older Americans, the Public Health Perspective. So the research problem, basically Brooks and colleagues decided to really focus on HIV within the older population and how new cases are being diagnosed every day. However, they also chose to look at a lot of other sub-problems that are occurring, such as the idea that people either aren't being diagnosed at all, or they're being diagnosed late. There's also a lot of identical risk factors for older adults as well as those who are younger. So people who are sexually active, maybe not using protection, things like that, they cross all sorts of age barriers. So it doesn't matter how old you are. If you are sexually active, you should be using protection. And also that preventative measures just aren't really hitting home. You might see them in your doctor's office, little brochures or pamphlets, but they might be being picked up, but they're not being read. So because the older population isn't being made aware of these issues, it's just a continuous battle with health professionals trying to create this from becoming an epidemic. That I thought was interesting, that they really tried to focus on the timeline of older adults from becoming infected, being diagnosed, and then the mortality rates and other things that could pop up, such as frailty and things like that are related to the disease. And then also there wasn't a clear objective with how they were choosing to use their research, because most of the information that they were getting from other sources, other surveys and things like that, but they still maintained a focus on awareness and prevention. So the methodology, as I said before, they didn't do their own research. Well, they didn't do their own formal research. They didn't have their own cohorts that they were following and conducting intervention programs or things like that. But they did use some existing surveys. They're all listed right here. So there was a Veterans Aging Cohort survey that they touched on that was discussing the decline in physical function within HIV-infected veterans and how they have a higher rate of the physical decline. The 2008 National Survey for Sexual Health and Behavior talked all about how older adults are not using condoms, which is huge. That barrier form of birth control is a not relatively great way to prevent the spread of diseases, but it's still something, and something to me is better than nothing. The multi-center AIDS cohort study, that, as I said before, they touched on frailty, so that was something that they chose to look at and showed how frailty, the body types of those who were HIV infected, who were around the age of 50 to 55, they had the same type of frail body types as someone who was almost twice their age, which I thought was very interesting. And also the Administration on Aging talked all about the current campaigns and materials that they have, such as fact sheets and posters. And because this is a health communication plan, the idea that Brooks and colleagues was trying to get across was that prevention is key, and by using these documents and things like that, we can really get the word out. So here are some examples. HIV, know the risks and get the facts. They have a couple that is very relatable. So I thought that was a really good one. And then I also like this one. I thought it was kind of nice to have a happy face. And you can see it says straight sex, romantic sex, casual sex, gay sex, curious sex. It doesn't matter. Age is not a condom. You might think you don't need to wear a condom because you're not going to get pregnant, but that doesn't matter. You still need to protect yourself from STIs and STDs. And so another form of the methodology that I thought was important to look at was the health belief model. It wasn't exactly like discussed within the article, but still the fact that a person can take the health-related action as long as they believe that the condition can be avoided, they can take the recommended action, and then the condition will be avoided, and that they believe that they can successfully take part in all of these actions to prevent the acquiring of the disease, or if they already have it, the spread of the disease, was huge. And I felt that that's really what they were trying to get across, was prevention and awareness. So if you have it, you can prevent transmitting it. If you don't have it, you can prevent getting it yourself by being safe. And here are their findings. They broke it down into 3 categories: HIV-infected older adults, non-infected older adults, and the public health practitioner, which I thought were really great audiences to try and look at from the health communication standpoint. So for the HIV-infected older adults, they were just basically trying to improve the coordination of care, the screenings, and the HIV prevention of transmission, because you want to make sure that those who are infected aren't transmitting it to other people. The non-infected older adults, you need to be more aware of your risk assessment and also increase your screenings to make sure if you are having unprotected sex or you're having sex with multiple partners and things like that, that you are being safe and you're making sure that you are aware of your own personal health. And the public health practitioners are basically raise awareness to your patients, make sure you're doing the screenings so you can get this early diagnosis caught, and also proper disease management of the chronic HIV that might already be affecting their patients. And there's my references. So I hope you enjoyed my presentation, and I hope I helped to open your eyes to HIV in older adults. Thanks for listening.